so many reasons that people do visit Academic Alliance in Dermatology. And one of the reasons is something that a lot of people don't like to talk about, especially adults. We're talking a little bit about acne today and how dermatologists can help. And I've got a great example here in Katie Rayberg. Katie, I'm so glad you joined us today.
Yes, thanks for coming.
You know, dermatology anymore, there's so many elements to it. This one we're talking about today affects more people than perhaps want to admit, right?
Yes, everybody, and usually their entire life is affected by acne. And the part that kind of gets missed is when adults get acne and what they can do about it. And is it hormones, or is it just rosacea, or what is the cause exactly? So when you come and see a dermatologist at Academic Alliance, you're going to kind of get the full skin check and then discuss what we can do about your acne as well.
I'm going to totally take one for the team and admit that, you know, I've been in a situation where you try different soaps and you try different over-the-counter things, and it's like you don't get results there.
Right.
And like you said, there's so many different reasons.
Yeah.
And it can also be one-stop shop when it comes to treatment options and how you can help those people, right?
Right. So treatment options can be anything from prescription, topical medications, oral medications, treatment options like laser, chemical peels, microdermabrasion. It just depends on what your skin needs. And a dermatologist is going to be able to tell what exactly each patient is going to need. So it's kind of nice that we can do that all for you. For the patient.
You know, and Katie, I want to ask, of course, we were talking about adult acne, but of course you think of teenagers a lot of time, and even you think of like women that are nearing menopause deal with it. Do you treat all of those different types of acne differently, and the reasons?
So you do, actually. So teenage acne, you typically go through a topical routine, oral antibiotics, and then to Accutane if you need to. But with adults, you have to figure out, is it due to a hormone imbalance? Is it due to another medical condition like rosacea? Is it because of PCOS or polycystic ovarian syndrome? Or is it just pre and postmenopausal, or is it after you've had a baby? So all of these things change our body and change how our skin responds. And so that's what we have to figure out and then decide on a treatment plan. So it can be a lot, but we are here to manage it and we can handle it.
I like to hear someone managing it. I like that you use those kind of words there. Now, briefly, you did mention treatment options. I heard you say lasers. Let's explain a little bit more about what that is, because that always kind of it's an intimidating word. I'm not going to lie.
It is. It absolutely is. So there are different devices on the light spectrum. So there are IPL and BBL, which are light devices, so intense pulse light or broadband light. And then there are laser devices like the Aerolace laser or the Halo laser that we have here available at Academic Alliance. So the difference being is that a light is going to be more superficial and a laser is going to penetrate deeper into the second layer of skin, into the dermal layer. And it can address things, pigmentation, acne, rosacea, fine lines, wrinkles, tightening and brightening the skin, all the things that we want it to do. And it just depends on what your skin needs.
So talking about how it kind of goes deeper into the skin, how does that vary with things like microdermabrasion and peels and some of these other buzzwords that perhaps you hear or have had done in the past?
So microdermabrasion and a chemical peel are targeting the epidermis, so the first layer of skin. And microderm is a physical exfoliation, chemical peel is a chemical exfoliation, and then a laser is going to penetrate even deeper into the dermis, so the second layer of skin.
So I'm just curious, but it seems like these maybe even work hand in hand. And again, that's where talking with you and how you manage really helps the patient achieve those best results.
Right, exactly. So we'll put together a treatment plan for the patient. This isn't just short-term goals. Yes, of course, we want clear skin. We want no scarring. We want, tighter and brighter as we mature. But how are we going to look in a year? How's it going to look in 2 years? What else can we add to the patient's routine that's going to improve their outcome?
And then when people do become patients of Academic Alliance in Dermatology, say it is for acne, you can also help them with maybe aging or sun damage. And that's where, again, it goes to some of those treatment options, right?
Yeah, absolutely. So then with aging, I mean, even the laser is going to help with that as well. And then we can also add in other skincare products. We've got Abaji, Skin Medica, Elastin, SkinCeuticals. All of these great products are available here, and they're the best of the best. So anything that you purchase at Academic Alliance is going to work for what you need.
Man, I don't know about you, Katie. I can't keep all of that straight. So I am sure glad there are people like you that can manage and help out patients like you at home. Well, as always, if you need more information and want to visit any of the locations, of course, of Academic Alliance in Dermatology, including the Trinity one, which is the one we're at today, say hello to Katie. But as always, just visit our website, TB Morning Blend, for more information.